So let us start a session again. And there were questions regarding what I spoke on the Instagram live. So we'll keep that Mathemedica a bit on the side because we did Calcarea Carb, Calcarea Phos, Calcarea Sulf in the Instagram live. And you can ask me questions again if you are interested there only, so that I can answer there. Otherwise, Calcarea Phos people had asked me related to anger, and I have made a reel also. So first go through the reel, and I think most of your questions would be answered. If not, then you can always ask me in the coming Thursday live. So there was one more question that I was talking Mathemedica and not taking the questions. So first, if you have questions, I'll take the questions first, and then again go to the my Mathemedica and the repertory part. So in repertory, what happens in homeopathy, there are different meanings of the repertory. The problem starts that whether there is you take the literal meaning, what is written, like example, desires light means that tube light or any light, sunlight, or desires light means desires some, he desires some your guidance, light, guidance. So you take that also. So it becomes sometimes difficult for the person to understand what to take and what not to take. It depends upon the experience on how you are getting results in your practice. Make sure, my advice would be that Hahnemann's case taking and taking the patient as a whole, and whatever you find in the patient's personality which is more very striking, very characteristic, please take that symptom. That symptom could be the symptom of the local part also. For example, bubbling sensation in the right iliac region or in the kidney region, or you can have pain at the tip of the urination, or you can have ball rolling on the urethra, in the urethra, or then the mental symptoms XYZ. So whatever is most striking, more characteristics, take that symptom, and then you can always enter the case and get results. Main thing is that other questions also were asked, that who to follow and who not to follow. My suggestion to all the doctors, the junior doctors, all the who are with me, whoever doctors you are following, first make sure that you are not impressed by the lectures or how much following they have on the YouTube and Instagram. That could be manipulated. Ask their students at how many results they have got, whatever they are speaking, they are actually dealing with that, and the follow-ups. And somebody who has joined the clinic, not the classes, joined the clinic, sat in the clinic for about 1 month, 2 months, 3 months, and understood their practice, their follow-ups. You can join those doctors, that because there you get the practical experience. Otherwise, one result here or there, a few results, sporadic results, everybody gets, because homeopathy is such a wide science that a polycrest has lot of actions, and it would be easy to understand a patient through a polycrest. So a lot of people have asked me, so I would just sum up all the questions so that I can answer everyone. Welcome, Dr. Good afternoon, Dr. Bharat, Dr. Vishaka, Dr. Mayur, Ram Prasad. Hair dye allergy, itching with burning on face, under eye, lips and all. Yeah, arsenic, but no. See, there are a lot of cases where the patient reacts to hair dye. Now there are two things, Ram Prasad. Everybody who uses the hair dye does not have the reaction. So in homeopathy, what Hahnemann says, that you should have the predisposition to that. If you are predisposed to react to a dye or an allergen, then the body reacts. That means it is a constitutional symptom. Acute symptom, acutely, if you want to do, just treat the symptom. You can think about histamine, you can think about Nux vomica, allosocratina. Sometimes it works, sometimes it does not work. So the predisposing factor is very, very important, because everybody who uses the dye does not get the allergic reaction. I hope you understand that the predisposing factors is very, very important. And one thing, about joining doctors, that if you are getting result consistently in that particular disease, but for example, if I present a case of hypothyroid, I have sporadic cases cured, but I am repeatedly seeing thyroid cases 1, 2, 3, 4 in my clinic daily, and then I'm getting results. That means whatever doctor you are following, he has some theory, he has some approach where it is working for him. That goes to all the diseases, whether CKD, chronic renal disease, or psoriasis, or eczema, or thyroid, or blood pressure, or sugar. The results have to be repetitive. 1 or 2 sporadic cases, everybody has it. So this is my humble request to everybody who are joining or getting appreciated by the books or by the social media, go in the clinic, ask the persons who have joined the clinic, ask your friends who have joined the clinic, and then you can always follow him. That applies to me also. So whoever comes to me, I always say, join me, work with me for a few months, and then see whether you are acquainted or you are understanding what my approach, and whether whatever you had come to me that I'll be able to see these cases, whether you're able to see those cases in my practice. And if you are able to see those cases, you're happy with the results, then you can follow me. So clinically, it is very important to understand whom you are following. Otherwise, you get attracted, including me in my 20-30 years back, and then we don't get results in our practice. So it is very important whom to follow and what to follow. Okay, I hope that part is clear, because there are a lot of questions asked to me, sir, we want to follow you, or whom to follow. This is my explanation to everyone. Good afternoon, Dr. Babel. Sir, you experience in renal stone pain, to relieve pain, sir, use Simlimum or? Yeah. So very interesting question, and very, very important in today's world. See, if you're seeing a lot of patients, as I am seeing it, the patient comes with too much pain. Sometimes in pain, it is very difficult to understand what symptom the patient wants to tell. The patient says, sir, pain is there. Don't ask me anything. Pain is there. Just relieve my pain first, then I'll tell you everything, sir. Sir, the pain is there. Or sometimes the patient does not talk. The associate talks, sir. He stops and associates that there is pain. In the morning there was pain, evening pain, night pain. We took this, we took that. Difficult for us to understand. So in these cases, I basically give LM potency repetition. Berberis vulgaris, Pareria brava, Colocynth, Belladonna, just the side and the pain. When the pain subsides, then I take the whole case and then I prescribe on the predisposing factors why this patient suffered from the renal stone, and then I prescribe. So I also do use sometimes LM potency repetition, only prescribing to relieve the pain, and sometimes I used to use before mother tinctures also, like Pareria brava also, Colocynth also, and Berberis vulgaris also. Once the pain goes, the patient is at ease, then I call the patient after 2 days and then start taking the case. I do that. In some cases, I get the constitutional remedy, I get the exact symptom I prescribe, and the patient is better in 1 or 2 doses also. But as a youngster, a guide for me is, I also used to prescribe sometimes the acute medicine only for pain. So don't be ashamed that you are only prescribing for pain and how will we get the result and all. You will get the result. I hope you understand, everyone. I hope this is the answer is okay to you, everyone. There was one question. Yeah. So on the WhatsApp. So I always say don't get me on the WhatsApp. So I hope you understand that. Okay. I am being very transparent. I think Dr. Barbel has joined my clinic, and she knows that I am very transparent, so that there's nothing to hide. I hope Dr. Mayur, Dr. Mayura, you understand. Okay. Sir, kindly tell some medicine for Klebsiella bacteria in urine. Nitin, basically, I don't prescribe on which bacteria and which remedy. I don't. So I cannot answer the question to you. Okay. In fact, there is a remedy called as Klebsiella 30 and 200 also. I don't know whether it works or not, but you can try those medicines. I will be going basically and what are the symptoms that are produced by the Klebsiella bacteria. Whether there's pain, there is burning, how much is the pain, where is the pain, the modality of pain, the character of pain, that is, more important. Okay. I hope your understanding. Sometimes I'm fast because there are a lot of questions unanswered. So this is understood. We have, a remedy called as Calculum renalis also. Okay. An internship at a clinic comes highly recommended. Thank you so much, Dr. Babel. That's what I was telling to a lot of doctors who want to join me. It is important to understand that the results have to be repetitive, not sporadic. And a homeopath should tell the patient of thyroid, I'm giving you the medicine, your thyroid is 10. Next time when you check, it has to come to 5. This confidence, if you have in your understanding of Mater Medica, that whatever symptoms you have taken for prescription have matched and you have done this before, then you can be confident in telling the patient that yes, the thyroid or diabetes will be taken care of. But it depends upon how much confidence you have in your own prescription. Otherwise, sometimes the assistant doctor comes and says, sir, whether the thyroid will be come to normal, and the doctor says, yeah, we have given the medicines and it should be fine. So that is a very vague answer. So the confidence will only come when you see the results repetitive. That is important. Okay, I hope you understand that. You can ask, you can always ask my doctors who are with me, who have joined me. There are 5-6 doctors who are working with me right now, and you can ask them. It should be transparent. The pathy has to grow. That is important for us. Okay, pus cells and mucus and RBC, protein in urine, extreme weakness of loss of appetite together with vomiting, feeling and all. Yeah, if there are a lot of pus cells and all, you make sure that extreme weakness. So whenever there is weakness comes, in homeopathy we have all acids: muriatic acid, phosphoric acid, nitric acid, arsenic also. So you have to describe again the other symptoms also. Okay, you can teach this symptom, then take the modality, and then you can always go to the remedy. So I was just last time, last time we were talking something about anger. I think I don't know whether anger or other rubric we were taking. So I don't know exactly, but today just the patient came to me, and the patient had a typical symptom. He was so angry, He used to bite things, tear things in anger and all. And I had prescribed the patient belladonna. And the patient came after a month. There was no change. Belladonna has that anger, bite things, tear things and all. So the patient came and told me, sir, yesterday night only we were sleeping and he was so angry. He just tore the whole, pillow. Everything came out. Yesterday he was wearing a cloth and that was not fitting her, and she tore the cloth. So I was, surprised at why belladonna did not work. When I went to the repertory and just put that rubric, anger tears things. There are other remedies also. So then you have to see what remedy not only prejudiced to belladonna. So this is homework to you. You just see which remedy I prescribe, and next time I'll ask you what you can think about. I'll take one question. Should I rely only homeopathy medicines and stopping allopathy medicines in ankylosing spondylitis? Female 26, she is suffering for 2 years. Yeah, a very important question. I have case of ankylosing spondylitis, much better with my treatment. They were on other allopathy drugs. Gradually I started tapering off the medicines, and in 6 months time we tapered off all allopathy medicines. In fact, after the 3 months only, I told the patient start tapering, but the patient was not sure. When I was visiting the doctor said, don't taper the medicine. No, don't taper. You take any medicine, but don't taper allopathy medicines. But we stopped all allopathy medicine, and he is much better now. He is following up for the past 2 years. Is absolutely fine. Okay, so you can gradually taper off the medicines. The main problem starts when you start tapering medicines of disease like metabolic disorders, especially thyroid, diabetes, and blood pressure. In thyroid, I had a case where the patient reacted very well to my medicine. She was taking 75 milligrams thyroxine. The thyroid still was 8.5. The patient came to me after 1 month of medicine. The thyroid TSH came to 3.5. And the patient told me, sir, whether to taper the medicine. I tapered from 75 to 50, and suddenly next month the thyroid shot up to 25. So then you have to be very sure that your remedy is right, increase the potency, and then it will come down. Because once this patient go to the allopathy doctor and they say, why do you take homeopathy? Nothing happens in homeopathy. So continue the medicine, whatever I have given. If you want, you can take homeopathy, but don't stop the medicine. And that creates a very black patch with homeopathy. So if you are very sure with your mater medica, then only you start tapering the medicines. I hope you understand that. This is how you have to taper the medicine, doctor. And understanding mater medica. See, in repertory you know everything, but last decision you have to go with the mater medica. So mater medica is a subject which you have to understand and learn according to what you feel, because you have to make your own picture. No, in 30 years I have cured n number of cases of a particular remedy, so I have a concept of that remedy, and that concept I have taken it from the source books. And now my mater medica is basically standardized and balanced. I know what I have to see in that remedy. And I've always tell to my assistant doctors who are working with me that make your own concept so that you don't forget. If you just follow my concept blindly, you will do the same mistake what I have done. So my mater medica, I teach them mater medica every day, and they also understand that. So my mater medica basically of understanding is from SORA to psychosis to syphilis. We are doing mater medica classes also, and we have wonderful response with that classes also. So mathematics is a subject which you have to develop by your own using the source books. Everything comes from the source books. Everything comes from what provers have told to the doctors like Hahnemann or Allens or Herring. And then if you understand those source book, you make a picture from that source book, then your mathematica, you can tell the patient that I have prescribed the medicine and it will work. I hope you understand what I want to tell everyone. I hope you what to prescribe in disc herniation. See, again, what happens, whenever a patient comes to you with disc herniation, means the disc has come out. Very difficult for a medicine to get the disc inside. First, it is important physiotherapy. I hope you understand. Physiotherapy is very, very important, my dear friend. And once there is a physiotherapy, there is a relaxation, and then you can give the prescribed similimum according to symptoms, and then gradually when the disc comes inside, the muscles become tightened, and then automatically the pain is better, and you can treat and cure the disc herniation. You go for MRI scan before and after, maybe 6 to 8 months again MRI scan, but make sure the patient does the back strengthening exercise every day, maybe 10 to 15 minutes in the morning and 10 to 15 minutes in the night. And make sure you tell the patient, don't bed down, don't lift heavy weights, and don't sit down. This is very, very important, because these auxiliary measures for treatment are also important, as Hahnemann says. Otherwise, if you don't treat the maintaining cause, you will never be able to treat such conditions. I hope you understand, everyone. Hello? Just write something so I also get a boost that you are understanding. Okay. Any good medicines for mental weakness? All medicines are good if you prescribe on the symptom totality. Any good medicines for mental weakness? All medicines are good, Doctor. What I want to, all medicines are good. Just your case taking has to be good. Let us go forward. Yes. Now, I was just telling you something in relation to Matra Medica. If you have seen my Calcarea Foss, if you have seen my Instagram live Calcarea Foss, the patient, whatever the patient comes with, sir, I in exams, don't talk to anybody, no my friend, no my family members, because if I get angry, then I cannot concentrate. This is a very wonderful symptom of Calcarea Foss. If you have seen my Calcarea Foss reel, or if you have seen my Calcarea Foss Instagram live, such a fantastic symptom. The patient in anger cannot concentrate. So that's why the patient does not talk to anyone, so that nobody makes him angry, and because of anger, then he is not able to concentrate. So this is a very, very important symptom, and you can take the symptom, the patient is introvert, the patient is reserved, the patient doesn't want to talk, obstinate, but because he cannot concentrate, that's why he gets angry. He cannot work because of anger. So your interpretation will decide which remedy comes and which remedy goes. I hope you understand, everyone. Your interpretation is so important. The patient does not talk. If you go to the core symptom, why, then you come to know he does not want to talk because he does not want to get angry. Because once he gets angry, he cannot work. So it's better to cut everybody. So you may think the patient does not want to talk, he has desire to stay alone, he has aversion to company, but no, the cause is something different, and you have taken a wrong rubric. Same way, if you have seen my Calcarea floor, the patient came to me, sir, please tell my child, he wants to eat every time. Once he sit on the studying table, he wants to eat. And the child says, sir, whenever I feel, disturbed, I cannot memorize, I want to eat. And when I eat, my concentration is very good. This is a fantastic symptom of Calcarea floor. So this is how you have to develop your Matra Medica. Otherwise, you can take the rubric gluttony, you can take the rubric, a lot of other rubrics, greedy for eating, XYZ wants to eat and all, voracious appetite, increased hunger during exams and all. But your understanding of that symptom was wrong. That's why you prescribe the wrong medicine. And then you say, sir, the medicine is not working. Hello, are you with me? So your interpretation and then going to the Matra Medica. and then going to the mater medica, and of course then taking out the symptom and the remedy, you will have a fantastic result. Today only I cured a case of gout. The patient was having gout for 3 years. He was taking so much painkiller that one painkiller in the pocket, one painkiller in his car, one painkiller in his house, one painkiller everywhere he goes. He was so happy. He said, "Sir, you don't know what you have done. This month I have taken no painkillers, but 3 times I have eaten chicken and mutton. But no pain, sir." And what the greatest important thing is what? He is a caterer. So he always has to make food. So he cannot taste also because of gout. And I gave that medicine and he is much is as good as cured only. So this is the interpretation you have to think about. So does arsenic will help in weakness? Is there along with urine? Yeah. Arsenic is there. Arsenic has UTI, arsenic has burning, arsenic has pain, arsenic has weakness. It would work. It's a polycrest. Sir, can you tell the difference between sulfur and Nux-Vomica? Sometimes getting confused. I have some sulfur who is perfectionist, type like Nux-Vomica, and anger also. Your opinion. If you are prescribing Dr. Mayura, only on fastidiousness or perfectionistness, you will never be able to get the remedy. Now why? Open the mater medica, open the repertory and please put fastidiousness. We have sulfur, we have arsenic, we have carcinosin, we have Nux-Vomica also. So this is a basic symptom. Whether you take fastidiousness, a basic human nature, or you say fastidiousness out of proportion, then you can take the rubric. Now, if you are a very keen observer, a sulfur patient would be very fastidious on how he looks and how he dresses. Beautiful face, all makeup and beautiful face, good tie, white coat, suit. Inside, the banyan toned. So appearance wise, sulfur is very fastidious, my dear friend. Appearance wise, sulfur is very fastidious. So if you mistake, in fact, if you take the rubric chaotic, if you go to the rubric chaotic, the first remedy in chaotic is, which remedy? Arsenic. And then you also say what to take. Fastidious also arsenic, chaotic also arsenic. So if you are prescribing only on this symptom, you will never be able to get the remedy. Sulfur for appearance. Now I'll differentiate one more drug, carcinosin. No. If one of the friend is coming to the home of a carcinosin patient, he will make the house spick and span because somebody is coming and he will see the room. So whenever he wants, whenever it is his, the matlabi dunya, so he will keep everything clean because his friends are coming, his uncle is coming, his auntie is coming, his XYZ is coming. That's why the room will be clean. That is carcinosin. Are you with me? Are you understanding what I want to tell you? This is the beauty of mater medica. Every time you are a student of mater medica, because you can never understand the remedy if you are prescribing on this type of symptoms. Are you with me? Yes? Nux-Vomica. Nux-Vomica, if you want to prescribe, there are few symptoms of Nux-Vomica which are so important. If I have some time, I'll tell you the most important symptoms of Nux-Vomica. And you'll be surprised, we have been taught Nux-Vomica is a businessman who works, but Nux-Vomica has anxiety about business with dyspnea. That is Nux-Vomica. And Nux-Vomica is, very quarrelsome and scolding if he is disturbed. You cannot disturb a Nux-Vomica patient. If he is working, let him work. Whether it is fastidious or chaotic or dirty, he should not be disturbed. If you disturb a Nux-Vomica, he becomes quarrelsome and scolding personality. Same, a Nux-Vomica patient, like I told you, Calcarea Fos has aversion to mental work after anger. So Nux-Vomica also person, when he is studying, he does not want to talk to anybody because if he gets angry, he cannot work. There is aversion to work. This is Nux-Vomica. Are you with me? Anyone? Are you understanding, my dear friends? If you basically or understanding, knowing the remedy in a periodized way, you will never be able to get that remedy. Are you with me? Now you can say dirtiness. If you say dirtiness means, one guy goes and he there is dirtiness everywhere. His clothes are dirty, his bike is dirty, his bedroom is dirty, his cupboard is dirty, but in that dirtiness the patient is dirtying everything. Sulfur is not the way of ammonium carb, natriuretic, bryonia, my dear friends. So this is the difference between understanding what prescription you want to do. In general dirtiness remedy, there are so many remedies. Ammonium carb is there, very dirty personality. Sulfur, laccan, graphitis, sepia, sorinum, naxomic also. Okay, so arsenic is never dirty. Remember, arsenic is never dirty. Okay, but sulfur is and naxomica is. Hello, are you with me? This is this is in fact if you have Mathematica or repeater in front of you, sensitive to filthy odors. I had a classical case of migraine case, sir. I cannot go where there is lot of pungent smell, dirty smell near garbage. That smell goes inside me and I start getting headache. And that remedy was sulfur, especially to odors. This is very, very important. Hello, are you with me? Are you understanding? Who had asked the question? I know, because when I am in my mood of Mathematica, I forgot what. Okay, so I'll just take one question. 26-year-old male pattern extra body has confidence struggle, cannot go out in public, feels I am ugly, I feel ashamed, body. Yeah, so the patient has a very consciousness of his body. There's a lot of consciousness, there's a lot of delusion that he will be criticized, criticized. Now the problem starts because if you think that, oh, what will people tell to me? Oh my, I have balding pattern, male pattern, people think. And if you take the rubric like this, you get one remedy, that is Bratacarb. The problem is that there are a lot of remedies apart from Bratacarb where the patient has delusion that she'll be criticized. In fact, in that remedy, in that rubric, we have lachesis also, ignitia also. I think we have Staphylococcus aureus also, and there are 3-4 remedies. But these 3-4 remedies I can. So you have to understand in what symptoms you are prescribing and which miasm the patient has come to you. I hope you are understanding, my dear friend, Dr. Kulbir. Yeah, everyone, did you understand sulfur and all? Sensitive to odor, very, very important, my dear friend. Now we have, sir, kindly tell some medicines where a person is having lack of interest in doing. Basically, these type of questions you have to find out why there is a problem, why daily active is a problem. Okay, that is very, very important. Yes. See, if you are telling that that odor goes inside the body and that creates headache and migraine, then because of the odor, that is important. In some migraine patient, he has no problem with the odor, he has problem with the noise. Then you have to take that rubric, noise. In some migraine patient, they don't have problem with the noise nor with the odor, they have with the sun. Somebody has the problem with the sleep pattern, somebody has problem with fasting. So it depends on which characteristic symptom the patient is suffering the most. Are you with me? This is important, and that becomes characteristic symptom. That symptom of last week obstruction smell, but before that I gave, sir, because anger who disturbed, also fastidiousness, but sulfur got result. Okay, very nice. So I hope you are understanding what I want to tell you. Okay, in this short span of 2 or 3 symptoms, whatever I understand about the case, my experience and my knowledge of Mathematica clinically, what I have seen in my practice, I am just telling you. Migraine patient, my dear friends, I have so many cases by the grace, and I have fantastic results. You can always ask whoever assistant doctors are with me and how I am practicing and how do I get the results and whether I have results. So that is important, so that there's a transparency, so that you can understand that why I'm pressing on what I want to teach you. That is very important. Otherwise I can open a Mathematica and start telling, that is not important. Urticaria always starts at night for mice. So, Devangi, the most important symptom is it is syphilitic after sunset. That is the first symptom you must see, and then there is some modality, Devangi, that is important. Better by cold, ward, bathing, itching. That is also the add one rubric more, and then you will get the remedy. Okay, I have seen most of the cases at night. Just give 1 dose of syphilinum, 200 potency, 1 pill, half cup of water, 1 spoon, and then the prescribed medicine. That works wonderfully. Yeah, we do have treatment for varicocele also, but it is already half an hour up. So thank you for everyone. Thank you for joining me, and I hope you enjoyed as much as I enjoyed sharing my knowledge with you. Thank you. Until next Thursday for Instagram Live. Bye.